Okay. We're looking for the expiration date. We already verified, checking here that the expiration date hasn't gone or hasn't passed. Now that we confirmed that, we're going to knock on the door. Mr. David, can we administer your eye drops today? And he said yes. As soon as that happens, we're gonna get some gloves. We're going to doff some gloves. I think this was called. After that, we're coming inside the presence of the room of the patient. We want to make him feel comfortable. We're gonna say, Mr. David, can we administer the eye drops again? Make him feel like that's okay. Just confirm that. After that, we notice there's a lot of crust in his eyes, and we say to Mr. David, can we remove those crusts off your eyes so we can administer the medication? He says yes. We're going to have a warm, wet, damp rag or washcloth to remove all the crust off his eyes from the inner outer, and then by the way you do that, you're just gonna cross this real quick. Get that. Get a little edge, just like this. And we're gonna come in from the inner and outer. This patient would have had his eyes closed, by the way. We wouldn't want to do that. And then we switch our fingers in a different position where there's no dirtiness, or we keep it as clean as possible. Inner, outer. As soon as that happens, then we're gonna put this washcloth here and get a new washcloth to dry him out. And then we're gonna go from the inner and outer. Same thing, same technique. Go on a different side of the washcloth, the dry one, to prevent any infection, because we want to keep it as clean as possible. Then as soon as that happens, we want to prepare for the administration of the medication. We have ourselves a separate rag, a clean rag, obviously. And we're going to use this rag to pull the bottom part of the eye while we administer the medication.
There you go.
And then as soon as that happens, we're going to gently rest our hand or our wrist here while applying our eye drops, or whatever, how many eye drops you need to administer towards the patient in the physician's order. So same thing here. Rest your hands here, and then 2 eye drops, because we want to make sure that we give him the same medication.